Thank you very much. I want to welcome members of the press to our proceedings this morning. Let me just introduce the head table. To my right, you've got the Chief Medical Officer in Dr. Sharon Belmar George. We also have the Deputy Police Commissioner in Mr. Milton Daisy to my left. I want to welcome members of the media that are here in person and in Zoom. We have just come out of a very good meeting with NEMAC, where we had members of the clergy, leader of the opposition, along with other representation from members of the St. Lucia Labour Party. We also had a great representation from civil society, including both from the business and social associations that have become very popular in our country. And we have had a very fruitful meeting where we've just come up with the list of protocols which will become the regulations for the period December 15th to January 11th. This is perhaps one of the most challenging times that we're going to be facing as we anticipate the Christmas season. No doubt there will be heightened activity, and so therefore we have been working together, the public and private sector institutions, to see how best we can have the best solutions so that we can overcome the many hurdles and obstacles that may come into our way as we seek to manage the COVID-19 pandemic during Christmas. So without any further ado, I'll call on our Chief Medical Officer to now give us the situation analysis on the health situation in the country. Madam CMO.
Thank you very much, Minister Fede. Good morning to all. As usual, I'll start with a global update. As most countries, both global and regionally, continue to note and manage the second wave of COVID-19, we continue to see that there's been over 61.8 million cases globally, with over 1.5 million deaths since the beginning of the pandemic. The region of the Americas continues to be the largest contributor for the new weekly cases, and followed by the European region. On a local level, we've noted a total of 270 cases in country. We've had a total of 2 COVID-related deaths, and we've done over 16,900 tests in country. We also have a total of 99 active cases in St. Lucia. To give you a little bit of information on this, the age group where we see the highest number of cases is the age group 25 to 49. That is 53% of our cases fall into that age range, and we continue to see that we have more females being affected than as compared to males. In terms of the distribution of our positive cases across the island, we continue to note the highest numbers in the Grosley and Castries area, which is shown by the blue blocks that you note. But in terms of the incidence, if we look at the population number per district, Labrie has the highest incidence still. This gives an updated, our current epidemiological curve to date. If you notice at the beginning, you'll see with our first wave where our rate of transmission was below 1. As we went into October, November, with the increased number of cases, our transmission rate was increased to as high as 3.9. Over the last few weeks, we are quite pleased with the response and the results that we are getting. We note that our rate of transmission is down to 2.3 when we look at the last two weeks. I just want to also indicate that we continue testing on a daily basis. So our testing strategy has not changed, but we note we've been noting a lot more negative cases, and the number of positive cases has reduced. This curve zooms in more into October, November with our increase in cases. From November, we noted the rate of increase had reduced, and we're noticing a decrease in terms of the trend from the end of November and into the beginning of December. That being said, as much as we are pleased with how the cases are going to date, we have less persons in quarantine and isolation, and also less positive cases of the reduced rate of transmission. I just want to indicate that the month of December, given the nature of December, the festivities and Christmas, it represents a high-risk period for us. So although we note the downward trend, it means we still need to keep very, very vigilant and not let our guard down, given the increases we have for the month of December in terms of visitors and nationals coming in. December will probably be the month with the record number of home quarantine persons, and that's home quarantine at a time that is known for socialization, known for increased commercial activities. So from our risk assessment, we note that December is of concern to us. We want to ensure that we can maintain the gains with our second wave that we have seen. So we continue to ask the public that although we see the reduction, we don't become complacent with it, to ensure that come January we're able to continue and stay safe. Thank you.
Thank you, Madam CMO. Before I go into the list of decisions that we took at the meeting, I would like to ask the Deputy Police Commissioner, Mr. Milton Daisy, to update you on some of the things that we're doing from the point of view of a national security standpoint, but as well to indicate some of the challenges that we may face from our borders and from internally, and all those issues will be addressed by him right now.
Yes, good morning all. Yes, the police, we are sorry about that. Yes, the police department, we continue with our enforcement drive to ensure that the protocols are being maintained. In as much as we encourage persons to be responsible and to follow the protocols for their own safety and the safety of others, there are instances where the police had to take decisive action, such as the closing of establishments. We had arrest of individuals. Also the warnings are still being given. We have situation where persons are still coming in through what we call the back door, that is through illegal ports of entry. We also have persons, especially the establishments, they remained open past the time that they were supposed to have closed, and also we saw that in some instances they were not observing the protocols that ought to be observed. So we had some challenges, especially with our patrols and so on in terms of resources, but that we are working with. I must also indicate that we at the borders we have some challenges, but we are doing otherwise in terms of the resources required to patrol the borders. In terms of arrests, there were many arrests made in relation to COVID plus COVID-related offenses, and one of the things that we realized is that in as much as there was not a curfew to say, but persons were out there and offenses were being committed during the time. So we had police officers deployed at strategic locations at various times and so on. So all in all, we felt that it was that period from the time the last COVID laws that we had some issues, but we are hoping to correct it because I think there would be some in the new protocols there would be some relax, some of some sort. However, persons should not take it as an opportunity to continue breaching protocols. So they still need to ensure that protocols are maintained, especially at the establishments, establishments where persons come in to buy, establishments, the supermarket. I know they have been doing a good job, but in terms of the number of persons in there, we need to go back to that, the lines, forming lines and ensuring that only the persons per square, the number of persons per square footage, these are the persons that are due to be in those establishments, and the others need to line up and so on. So that we are encouraging persons to do, so that we, especially in the festive season, so that we could have a safe season. Yes, thank you.
Thank you, Mr. Daisy. Now we will share with members of the press the list of decisions that were made at the NEMAC meeting, which will constitute the new regulations for COVID-19 under the the COVID-19 Preparedness Bill Act, along with other public health legislation which we have in the country. So this will be instituted from the period of December 15th to January 11th. And the recommendations include the following. Number one, the continuation of a blend of working from home and also at the workplace where possible. So the Chamber of Commerce and other stakeholders were on the call, and we had very full concurrence on the issue of a blended approach in terms of board meetings and call centers that can institute technology to allow their employees to work from home. Decision number two was the continuation of the current regulations for business operating hours, but only to amend it to now move it from 9 p.m. to 11 p.m. So that also was the decision-making process. This was to allow for the facilitation of Christmas shopping, so that we can reduce the number of crowds, so that we can allow businesses to better manage the flow of individuals that are going through the various business places during the Christmas period. We also had decision number three. The restrictions on social gatherings are up to 25. It remains that way, but we continue to work with the churches on the square footage. But as it relates to funerals and christenings and weddings and other religious rites, what we have indicated is that they can now move to 50. The churches have done a tremendous job in facilitating and enforcing the protocols, and so therefore we are in a very comfortable position to be able to allow them greater flexibility to be able to manage the flow of traffic through the various institutions. Decision number four, we had the restriction on the sale of alcohol, and you would remember that while we allowed the grab and go in restaurants and in bars, the bars were allowed under the previous protocol to close at 4. We're now saying that both restaurants and bars can continue to serve alcohol within the premises and also on a takeaway basis up to 11 p.m. This would also allow the restaurants to reinstitute the dine-in facility. The restaurants, by and large, have done a good job in instituting the protocols, but I want to make it absolutely clear, to echo the sentiments of the police that's present here today, that there will be a zero tolerance for violating the protocol. The businesses that are found violating the protocols could face a complete shutdown for as much as 2 weeks once the police would have found them to be in breach of the protocols that has been instituted for the safety of the general public and for themselves. And so therefore we are asking everyone to work with us. The reason why we have seen a reduction in a number of the cases, why we're situation, is because there have been improved compliance of the protocols in a lot of our communities. And so we're asking you therefore to continue to help us over Christmas, be responsible, protect yourself, and also protect those that you love. We've made an amendment to the regulation as it pertains to sporting activities, so we're now allowing gyms and other non-contact sports like tennis, for example, to be reinstituted and to be allowed as part of the protocol. So that was the 5th decision that we took. The 6th decision that we took really was to continue as is the special exemptions we made for the education sector, for students to have face-to-face tuitions where necessary, for lab work to be done, for SBAs to be done, for students who are in the process of preparing for CXCs and CAPE and also the common entrance examinations. We want to have an environment whereby all of the students are going to do well. Now, part B of decision number 6, we had a number of recommendations. One is for the private sector to have in a more structured manner the shopping day tradition which we've had over Christmas time, so that we can see a better flow of traffic. 2, we have encouraged slaughterhouses and butchers to remain open but with strict protocol in the safety of the public. We've also reached out to banks and credit unions, and we're encouraging them to allow for individuals that are going to utility companies, for example, to pay their bills, to better manage the flow of the queues into these various institutions. So we're recommending perhaps an increase of staff, but to put in some systems that would allow for a greater flow of individuals and to avoid the long queues that we have seen as we anticipate increased crowds for Christmas. We also agreed that there will be no Christmas parties, there will be no New Year's Eve celebration in public of any kind, no Asu Square, no National Day or Juve celebrations, and there'll be no corporate staff parties, etc. These really are the decisions that we have made. We are pleading with everyone to help us to enforce these protocols so that we can come out winning. There has been significant gains made in the recovery of our economy and in a reinstating of life as we know it. What we don't want is to have to go back to stiffer measures or stiffer protocols where our lives and where us earning our livelihoods will be disrupted. And so it is crucial that we work and cooperate with the authorities to help us to keep each other safe. Merry Christmas. I hope with that you have no questions. Yes, we take questions now.
Lucia Shalmang, Choice News. I want to know what influenced the decisions to have bars do in business service as well as restaurants to have dining in, because a lot of people were of the belief that because it's the festive season, maybe we would have buckled down on restrictions, but we seem to have freed some things up. What influenced that?
We'll get our CMO to take this question, but just as the CMO prepares, I want to indicate that members of the press that are by Zoom, yes, just indicate by raising your hand so that we can take your questions as well via Zoom. Thank you for that question, Ms. Shalmine. The question on the floor is for our CMO.
Yes, we note that the December month, it does pose a time of high risk for social activities. However, the protocols, once implemented, the biggest issue we noted was not with the protocols and the policies, but the implementation. Given that we will have better regulation through the use of the COVID wardens who will be monitoring those institutions, we are hopeful that we'll be able to have better regulations of that facility, because in our discussion and our assessments of, for example, the restaurants, what we noted, there was a huge variation in terms of those who are able to implement safely and for those who don't. So as Minister indicated in the presentation, there's a low tolerance at this point, given we have the manpower on the ground to ensure that only the services that can do it safely are allowed to remain open. So as we move towards living and surviving with COVID, our main push is to ensure the implementation and adherence of those protocols, given a balance so that persons can also live. We're also cognizant of the fact that it is the Christmas season, and the mental health effects that a lot of the protocols that have put on everybody involved. But we want persons to be able to make the family time. If you notice, we've increased the numbers to 25, and that is to say public social activities are not allowed, but small family and less than 25 or 25 to the max would be allowed for Christmas Day and say New Year's Day. So we want small, intimate family activities to allow some level of celebration of Christmas without the big public activities that could further increase the risk, given the nature of Christmas.
I see Zane Romulus. You've got your hands up.
Yes, good day everyone. Zane Romulus, TVS Television. I guess this is a question for Deputy Commissioner Milton Daisy. I wanted to find out the status of the COVID enforcement officers, their training, and when will we see them on the streets?
Yes, the training, these officers, the training will be, that is the in-house training would be completed on Saturday, and they would be on the field from Monday the 14th. Whilst on the field, as I've indicated before, they would be accompanied by some senior other officer who would teach them the way around, the patrol methods and so on. So by Monday, we should see them out in full force at the various communities.
We have a question here on the floor. Sorry.
All those questions are for you. Genevieve Gonzague, Hot 7 TV. Can we get an update on the capacity of the respiratory hospitals? And also, given that the vaccines are the big talk now, how would it be rolled out when it gets to St. Lucia?
The capacity of the respiratory hospital, we were at 86. I would have to get an update on the last set of rooms. I know some of the World Bank ones have been completed. As to the exact number, I don't have it there, but we should be close to 100 by now. I could send the last through our communications unit to you to give you an exact number, but I know we have increased the number of beds for the last few weeks. In terms of the vaccine, you wanted to know what's the plan for the rollout. We've developed an COVID-19 vaccination implementation team, which is being supported through the Pan American Health Organization, which is the organization which we routinely get our vaccines for. They are working on the implementation, the rollout. The communications and education aspect is going to start off in January. There are a number of aspects that are not completely defined and require policy decision, but just to let you know that we are waiting the approval by WHO of the vaccines that some of them are already being used. As soon as we get that approval as to which one that is approved in terms of meeting all of the safety trials, we will be sharing that with the public. There are a number of recommendations that's going to go to Cabinet in terms of the implementation. For example, the cost, if any, we are hoping that it will not, because I don't want to preempt any decisions. In terms of our first persons to get it, we are looking at our high-risk groups and our frontline workers, and we are looking at the policy for dissemination. Given that it is a new vaccine, we will ensure that the public gets all of the necessary information on it. We are planning a huge stakeholder meeting with the health-related sector for next week. So we want to ensure that we have as much stakeholder involvement in the implementation of the vaccines and the recommendations that we make. So as soon as some of those decisions are final, we will be having a press briefing to give you that information so that the public is well informed.
Okay, just before the next question, I would like to read an important notice, which I would love to ask members of the press, your corporation, to distribute. Due to the large number of queries to the Office of the Prime Minister regarding the upcoming holiday weekend, the public is reminded that St. Lucia 13th December, also known as National Day or St. Lucia Day, is a bank holiday, public holiday. Pursuant to the Bank Holiday Act, Cap 1701, when a bank holiday falls on a Sunday, the following Monday immediately next is deemed a holiday. So therefore, the Office of the Prime Minister reminds all St. Lucians to continue to observe all COVID-19 protocols and wishes to remain a safe and enjoyable holiday weekend. We would like to further announce, which is what you've all been waiting for, that Monday, 14th December 2020 is a bank holiday in St. Lucia. So do enjoy your holiday and be safe, but also be merry. Okay, we continue with your questions.
Are we satisfied with the adherence of protocols in the last 2 weeks or since we last met here? Because as a member of the public, I have observed restaurants, bars flouting protocols, and it doesn't seem that law enforcement is there to stop them. So how efficient have we been in monitoring? And how can the public trust that we will be efficient in monitoring between December 15th and January 11th?
I'll just add my voice to say that a couple of things. One is we see that despite, what you have described, we see that the cases are coming down. So this is clearly driven by the science. But then secondly as well, we have another layer, and that is the building of capacity of the wardens which are coming into place. And we're hoping, as outlined by the CMO and the police commissioner deputy earlier, that we are going to be in a better position to be able to work this through. We are also working with the private sector to ensure that the assault of messages encouraging individuals to stay at home and to only go out when necessary and to follow the protocols that have been instituted, that we have seen that this is also going to help. The business houses, the commercial places have done a significant job in helping to enforce the protocols. There are a few tweaks here and there which we have discussed this morning that I think we will see refinement in the coming days. But I believe that when you put all of this together, we should have a more improved environment. I don't think that we can completely enforce the protocols from an enforcement point. But what we can certainly do is encourage the public to cooperate with the authorities. And I think what is required now is for each of us to take responsibility. And the more responsibility that we take as individual citizens, I believe we will have a better success rate of keeping each other safe.
Okay. Can you give us some insight into the discussions taking place to guide the second term of school that will reopen in January? Do we have any proposals on the table? And if yes, what are they?
Okay, the Ministry of Health, we're working closely with the education sector, and they've been having intense reviews and discussions on the plan for the new term. So I will not preempt the Ministry of Education. They will communicate to the public the plan for the second term very soon. They are presently also doing quite a few stakeholder discussions with their various stakeholders in preparation for the decision for next term. So very soon, an update will be coming from the Ministry of Education with regards to the plan for the second term.
Yes.
Unrelated to protocols, but still within COVID, a lot of people have been asking the question as to whether it should be a mask and a face shield or just a face shield on its own. Let's be very honest, the Prime Minister has been wearing just a face shield and has come under a lot of criticism. So from a medical perspective, how effective and efficient is the wearing of just a face shield?
Okay, from a safety point of view, to reduce transmission of COVID-19, the recommendation is the use of the mask in public places. The face shield provides limited coverage for transmission of respiratory illness. So the recommendation would be the use of a mask as much as possible when in public places.
Yes. Sure.
Final question from me. Vaccinations. We have seen a vaccine rollout begin in the United Kingdom. We have had a few people vaccinated between yesterday and today. We've had 2 NHS workers who have had allergic reactions. Here in St. Lucia, we have a lot of people perpetuating what I would call disinformation on vaccinations, persons making videos and pretending to have side effects. How does the Ministry of Health plan on combating what is obviously a culture of skepticism in St. Lucia, especially for new developments like that vaccine?
Just give you some information. Like we indicated earlier, the first aspect of our immunization rollout, well, the first aspect is actually the stakeholder consultation with our health-related stakeholders, which we intend to do during the month of December, ahead of our communication and education plan that we are going to roll out in January. From the initial data and information that we've been able to capture, we anticipate a level of resistance from our population. One of the surveys that was done by Johns Hopkins looking at the acceptability of the potential COVID-19 vaccine, where the survey was conducted in 67 countries, 16 of them in our region. And the variation was quite great. For example, places like Brazil and Ecuador, the acceptability was as high as 85 and 80%, whereas Trinidad and Tobago and Jamaica, that was included. For Trinidad, the acceptance was as low as 45%, and for Jamaica, 35%. And we think St. Lucia would be close to that, especially given that there is already a level of skepticism for vaccines, and this is a relatively new vaccine that is being proposed. Also, Mr. St. Catherine, in his presentation to the People's Parliament on the research and innovation, he did that presentation on the 23rd of November. One of the aspects of his research included one of the questions which said, would you take the COVID-19 vaccine as endorsed by the CMO? And it was a sample of 400 persons. The number of persons, the percentage saying yes was only 15%. 56% said no. We had 21% who said maybe, and I mean, this is a case of persons who are not sure. And we had 8% saying they don't know. So we have maybes and don't know in a huge 21 and 8%. So it means the public needs a lot of evidence-based, accurate information to make informed decisions, but we need to be guided by the science. Those are companies who are used to making and creating vaccines. The family of coronavirus is not new. This is a new strain, this is a new disease, yes, but the substrates, what they're using to create those vaccines, is not completely new. So I think ensuring that the public has relevant, accurate scientific information is extremely important before we actually start the implementation of this vaccine. So we anticipate a level of resistance from what the initial data is showing. So we are definitely going to ensure that accurate information is coming out to the public on that. And as with any other medication, you always ensure that the benefits outweigh. So you have to do that risk assessment. If you're somebody of high risk of developing complications or severe disease, I think this is one of the things you would need to look at. Generally, the side effects of vaccines have been very mild, and we keep a record of our patients to date. We're also monitoring closely the countries that have started implementation to also see what those reactions may be to support when we are ready to roll out in country.
I see that there's another question on the floor, but let's explore Zoom for a little bit so that we're not accused of monopolizing the time of the press conference. Any questions via Zoom? No, we don't see any, so yes, you may. Hot 7. Oh, we have Riani from NBC.
Good morning and season's greetings to the head table.
Yeah, just speak a little closer to the mic so that we can hear you.
Sorry, is this any better?
Yeah, very much.
Okay, yeah, season's greetings to the head table, everyone, media colleagues.
Season greetings. Yeah.
We
were just trying to figure out where is the press party, if there's any, and whether there are any protocols.
If you organize, we'll attend. My question is, a statement from the health ministry yesterday indicated that St. Lucia is at a heightened risk of contracting COVID-19 at this particular point of the year. And if I'm not mistaken, I think the CMO indicated that as many as 25 people are allowed to privately congregate. So just to understand, my relatives from whether it's Labrie or Rose Lake Casteries, once it's 25 of them can come visit me this Christmas, this New Year's, and that will be okay?
I think your reasoning is quite justified, Mr. Isidore.
Yes.
The Christmas season by its nature, and for us in St. Lucia, when we did our assessment, we have over 1,000 returning nationals coming in, and also the increase in the visitor arrivals coming in during the month of December is also of concern to us. Given our capacity for government or institutional quarantine, it means we'll have an increased number of persons on home quarantine. And given our history of managing home quarantine and the lack of compliance and adherence, this is one of the risks that we looked at in relation to the month of December for us in St. Lucia particularly. Also, given this a season for socialization, increased economic activity, it's a time when persons drink more, they eat more, there are more staff parties, staff activities. This is one of the reasons that we've asked the public that although we are seeing reductions between November and December, we're seeing reduced numbers of cases, we have to remain vigilant with the protocols to ensure we keep and we stay safe during that period. Notwithstanding, we also recognize that it is the Christmas season, and especially for the Christmas day, an allowance was made to facilitate family gatherings. You note the considerations for Christmas which was presented. We've limited staff parties. We indicated none of the staff parties that are allowed, the Juve, the Asu Square. A lot of the public-related activities have been taken off, but to allow some level of family activity, for example, for the Christmas day, is being allowed. But we continue to ask the public that, especially if you're in the high-risk groups, to err on the side of caution, to remain very vigilant, to do what all of the measures that we have been recommending before to ensure we don't end up with an increased number of cases. We also put out a special alert. Our communities are small. We know who's coming in. We know who's on home quarantine. To avoid visiting during the period of quarantine homes of persons who are in home quarantine. We've had experiences where persons are on quarantine and have quarantine parties. We are hoping we don't have to deal with this over the season. If you know someone is in quarantine, they shouldn't be leaving, but persons should not be visiting them while they are in quarantine. We know the temptation will be greater during the Christmas season. It is a time of a lot of activity, but we have to err on the side of health and safety at this point. Thanks.
Thank you, CMO. Do we have any other questions? I think there's a question on the floor from Hot 7. If there's anyone via Zoom that would like to ask a question, please indicate by raising your hand.
Okay. Given that we may be expecting a high influx of returning nationals, what exactly is in place for these people, and how will we continue to monitor them, when they are in home quarantine?
In terms of managing the increases that we are expecting and we are seeing in December, a number of measures have been put in place. Our assessors per region have been instituted, where we assess the homes before persons come in. We've also put stricter regulations on the acceptance of persons for home quarantine coming down. We've also increased the number of persons doing the follow-up and the checks for home quarantine within the communities. And we have the Assistant Commissioner has accepted our request for designated wardens within the communities to be doing random checks at various points of persons' homes to ensure compliance within the home. So the home quarantine team will be getting some of the wardens to assist us in monitoring the homes during this period of increased persons coming in and also increased activities.
Joshua Sintimi from the Star. Joshua? I see the hand of the Star Publishing up. Is that Joshua Sintimi?
Can you hear me?
Yes, we can.
Hi, good afternoon. Regarding the home quarantine, what about the tracking devices? When is that going to be rolled out?
Good morning again. We are supposed to receive the tracking devices this week. We did a pilot process on the first batch, and it worked well for what we want to do. And we are also doing the review of our first set of the bio buttons that we have received right now. So we are hoping that by next week we can commence with the use of the electronic devices.
Regarding the bus drivers, will they be given their full capacity, and if not, why?
Joshua, how did I know that you were going to ask that question?
The protocols that have been put in place for the sector for the bus drivers and every other sector have been placed there to ensure health and safety of everyone involved and for reduced transmission. We have the Ministry of Health. We've had quite a few meetings and consultations with the Minibus Association and their members. A minibus, it provides a high-risk service based on the square footage and the number of persons that can be on board. In our initial protocols, the recommendation was initially 7, and we increased it to 10 after a number of meetings and consultations with the sector, keeping in mind that for 10 persons within a bus, it has to be with the strict test of protocol adherence. At this stage, I know the association is in consultation with the ministry to see how some level of acceptance can happen moving forward. But the protocols are put in place to reduce transmission of COVID-19 and to ensure the health and safety of the bus driver and all of the passengers who use the service.
Thank you, Joshua. Thank you, CMO. Any other questions? I think Hot 7 has a question on the floor.
DCP Daisy, in the past 2 weeks where bars had to be closed at 4 p.m., was there adherence to that protocol, or did the police ever have to go in to shut down bars, whether in the city or the outskirts?
Yes, I must indicate that many persons observed that 4 p.m. close. However, the police had to shut down many bars after the 4 p.m. What we also noticed is that even they were complying to the 4 p.m., but during the sales that there were non-compliance to some of the protocols that were put in place. So we are hoping that with the addition of 200 hands, that we would be able to monitor better and have stricter enforcement.
Okay. Any other questions? Okay, thank you all very, very much. Nicole, are you happy with this? Thank you, members of the media. If I don't see you for Christmas, do enjoy yourselves. I'm accepting all of your presents at the office at the waterfront. Just letting you know, Mr. Sheffield, that you can send my present over to the waterfront. So thank you all, and do enjoy the season. Be safe. Enjoy your viewers. Really join us in this time to really to cloud out information that is false. The biggest job that you can do, the media, is really help us to clarify a lot of things. We're certainly going to be available to you over the Christmas season to make sure that we give you timely information on the various issues pertaining to COVID, as we are going through one of our most challenging times in the management of this pandemic. Not only the festivities, but the whole mood of our country. And the festive season will bring with it its own set of complex challenges. So therefore, we're pleading with all to be safe and keep your loved ones very safe. Thank you very much. Merry Christmas.